Good morning, and thank you for joining the City and County of San Francisco's COVID-19 update. For Q&A, please state your name, outlet, and up to 2 questions in WebEx chat. Questions will no longer be taken after the last speaker's remarks and when the Q&A portion begins. And now we welcome Mayor London Breed.
Thank you, and good morning, everyone. Today, we're going to share some information on our vaccine rollout and where we are with COVID-19 in San Francisco. First, we continue to see the impact of the December holidays. Our cases are still climbing. We have 333 new cases per day, but they seem to be increasing at a slower rate. And our hospitalizations remain as high as they've been, but also seem to be slowing. Our reproductive rate is still above 1. It's about a 1.06, but it's itching down. And we know getting below 1 is key. And most importantly, more and more people are getting vaccinated every single day, especially our seniors who are the most vulnerable to getting sick and dying from COVID. This should give us all some very real hope. It's going to be a long road, but the road will begin to lighten. I can see it. It's not tomorrow, but it's soon. Right now, we need to continue to focus on doing the hard work each and every day to get through this. It means getting the correct information out so that people know when it's their turn to get vaccinated. And it means we need to keep wearing our masks, keep our distance from each other, and follow the public health guidance. And the city needs to keep finding ways to support our residents and workers in the months ahead, even as people get vaccinated. That means helping working people who get COVID and who need to take time off from work to isolate. In the absence of real programming from the federal government, the city has been at the forefront of providing financial relief for those who get COVID and need to isolate through our Right to Recover program. So far, we've offered $4.5 million in support for this program, which has provided 3,200 San Franciscans with direct financial assistance, including many from our Latino community, which we all know has been disproportionately impacted by COVID. Today, we're allocating another $6 million to fund this program going forward, bringing the total support to $10.5 million. We are doing this by tapping into unused funds paid into our Healthcare Security Ordinance Fund, which is usually used to provide health insurance for workers. Early in this pandemic, we successfully used the funds in the Healthcare Security Ordinance to provide $500 checks of immediate relief to people who qualified, like restaurant workers and bar workers. Now, by working with our labor partners, we've all come together to recognize that providing direct financial assistance for those who test positive during the pandemic, we are fulfilling the ideas of the Healthcare Security Ordinance. And I want to thank our labor partners and the Latino Task Force for helping us with this. I'm really proud of the Right to Recover program. It's been one of those shining examples of how the city has stepped up in the absence of federal leadership and provided support. We are continuing to move forward with distributing the vaccines through our Department of Public Health and our private providers, but we also continue to face challenges with the lack of supply. To show you what's happening in San Francisco, let me walk you through some slides. Let's start with the Department of Public Health, which is charged with vaccinating workers at San Francisco General, our EMTs, and other frontline community health workers, as well as those who are 65 and older within the San Francisco Health Network, which serves the most vulnerable and underserved people of the city. So far, the Department of Public Health has received 31,655 doses and administered 15,545 doses. Of those doses that have been administered, 12,920 have been first doses and 2,625 are second doses. That puts our utilization rate at 49.1%, which is above the national average. All of the Department of Public Health's remaining vaccine doses are scheduled for individuals to receive their first or their second doses this week. And unless we get more vaccines, the Department of Public Health will run out of our existing supply by this Thursday. We do not currently have this level of data from our private healthcare partners, but we are working with them to get it. Overall, in San Francisco, we do know that as of yesterday, 28,501 San Franciscans have received at least one dose, with 6,347 of them having received their second dose. This is across all of our providers and is largely healthcare workers who live in San Francisco. To give you the overall picture of where we are with Tier 1A, it's important to note that our entire system in San Francisco has received about 102,000 doses. Again, these are for both first and second doses to everyone, including Department of Public Health, Kaiser, Sutter, Dignity, UCSF, and others. Tier 1A in San Francisco is comprised of more than 210,000 people, all of whom need to receive 2 doses, including approximately 80 to 90,000 healthcare workers, 11,000 in-home care workers, 110,000 people over the age of 65, as well as EMTs, community healthcare workers, and others who qualify in Tier 1A. This really shows that while we are making progress, we simply need more vaccines. As I said, we are going to be out of our vaccines this week if we don't get more. Now, I can't do this presentation every day, but people do want answers every day. So to better track vaccine distribution, we launched a new vaccine dashboard, which you can find on the city's COVID dashboard, where you normally find our case rates and hospitalizations and other key data. This dashboard will tell you how many people have been vaccinated in San Francisco, first and second dose, and how many doses are given to people daily. This is the first version of this dashboard. When we have more data, we will add that to the dashboard. We're working with other healthcare providers in the state to get this data, and today the Department of Public Health is issuing a health order to help us get this data from those providers. This health order will require the providers to provide basic distribution data so we can better fill out this dashboard and understand what's happening in San Francisco. I really view this health order as part of our collaboration with our private providers to set up our vaccine sites and to get people vaccinated quickly. I know we are all anxious and want to know how we are doing, but remember, the vaccine is in limited supply. Every single dose in our possession is accounted for and earmarked for an individual. We're also moving forward with setting up our vaccination network, including the build out of the first site at City College. While we still don't have the vaccine supply to meet the needs of these sites yet, we are getting ready for when we do. Our goal is to be ready to quickly move to Tier 1B once we have the supply. To make sure you are aware when it's your turn, you will be able to go to sf.gov/vaccine notify. Our city technology staff have been working all weekend to prepare the site for what they know will be a significant volume of interest, and it will be up later today. When it's live, you can enter some basic information, including your name, your occupation, your provider, so you can be notified when it's your turn. I understand that this has been tough for people. There's a lot of information out there. We're doing our best here locally. The good news is that starting tomorrow, we're gonna have more support from the federal government. Even before tomorrow's inauguration, the Biden administration has already made clear what their plans are for expanding the fight against COVID. These include things like activating FEMA and the National Guard to support large vaccination sites, potentially using the Defense Production Act to expand the supply of syringes and other critical materials, provide direct support to individuals and small businesses who are suffering from this pandemic. Frankly, these are the basic things we should have been doing all along, but I'm excited to see them finally being put into action. This is what leadership looks like. And the hope I feel for our city is real, and our country is real. That hope is not based just in vaccine rollout, but in how they are planning to immediately rejoin the Paris Climate Agreement and reverse the discriminatory travel ban. In their talk about how they're going to overhaul our immigration laws, and then there's just the basic message of our core values as a country. Those of valuing our core democratic principles, celebrating unity and restoring common decency. It's been a long 4 years, but we are finally moving forward. And on top of that, tomorrow will be a historic day for our country, because tomorrow we will see for the first time a woman, a Black woman, a Southeast Asian woman taking the oath of office to serve as our vice president. I am so excited, not just because Kamala Harris got her start in the political world right here in the Bay Area. I'm excited because she has been a mentor, a friend, and a supporter of so many people throughout her entire career. She has been compassionate. She has cared about people and their individual struggles and challenges. And I know she's going to bring that same passion and love for changing the country to her new role as vice president. And I can't wait. Now, having said all that, I know I'm not the only one who is excited and ready to celebrate. But as always, I'm here to remind everyone, we are still in a pandemic. The celebration we all want to have, the one that we normally would have, sadly cannot happen. We need people to stay home, to watch the inauguration where they are, and to avoid gatherings. Trust me, there's nothing more that I want to do than to go out and celebrate and hug everyone as we watch Kamala Harris sworn in as the vice president and Joe Biden as the president. I'm getting excited just thinking about what this means. But we all need to keep doing our part. We need to get through these next weeks safely. Keep slowing the spread. Get vaccinated when it's your turn and wear your mask. So please, for the sake of at least being able to reopen this city by the spring, I am begging you all, no large gatherings. In addition, I know there are a lot of concerns about what we saw in Washington, D.C. a few weeks ago. The violence and the indiscretion of our Capitol were shocking and disgusting. And I know people are nervous about something like that happening right here in San Francisco. Well, let me be clear. We will be prepared for anything tomorrow. Our focus is and always will be on keeping people safe. So before I bring on Dr. Grant Colfax to provide the data on where we are with our transmission rates, let me have Police Chief Bill Scott speak a little bit more about the city's plans for tomorrow. Chief Scott?
Thank you, Mayor. As Mayor Bree said, tomorrow is going to be an exciting day with the inauguration of President-elect Joe Biden as the President of the United States and our own Bay Area Senator Kamala Harris, the first female African-American, as the mayor said, the first female Asian who will be the Vice President of the United States of America. The nation has been on high alert following the January 6th attack on the U.S. Capitol. However, I want to update you on our city's preparedness for tomorrow's events. At this time, we have no credible notifications of major protests or civil unrest likely taking place in the city and county of San Francisco. However, we will be prepared for anything and everything. Out of an abundance of caution, the San Francisco Police Department is working closely and coordinating our efforts with our public safety partners at the local, state, and federal level in order to preserve order and protect everyone's safety. At SFPD, we've canceled discretionary days off of our officers, and we will have additional police and all necessary resources deployed to respond to all routine calls for service, as well as spontaneous events in the event that they occur. We're closely coordinated with the San Francisco Fire Department, which is fully staffed and well prepared to meet fire and emergency and medical needs that may occur citywide. And we're also coordinating with the San Francisco Sheriff's Department, which has an increased presence to safeguard City Hall and other city buildings, as well as those who work there. Our City Emergency Operations Center, or our EOC, is fully activated to support citywide coordination, situational awareness, and resource management citywide for Inauguration Day. As you've heard me and many other law enforcement professionals say in the past, if you see something, say something. Please call us. As always, we remind San Franciscans, help protect our city. Report what you see. And remember, if you see something, say something. If you witness criminal or suspicious activity, call us. We will come, we will check. We want everybody to be safe and we want everybody to feel safe. Our 911 call is an emergency center that's 24 hours a day. You can call at any time. And if it's not an emergency, call our non-emergency line at 415-553-0123. That's 415-553-0123. And as a couple of reminders, I want to reiterate what Mayor Breed said about COVID. Although we know there are no public safety threats at this time, civil unrest or protest planned in our city, we cannot forget the serious gravity that the COVID-19 pandemic has caused in our country. COVID won't be taking tomorrow off. So please listen to the mayor, stay at home. The events will be televised and we are encouraging you not to gather in large gatherings in public. At the San Francisco Police Department, we join Mayor Breed and Dr. Grant Colfax in urging all San Franciscans to celebrate Inauguration Day at home. Watch it on TV again and celebrate those in your household, celebrate with those in your households. You can go online and you can celebrate virtually. Please remember that outdoor gatherings of individuals from different households pose a significantly higher risk of virus transmission, and the virus is still a threat. So please take heed to those basic public health advice. That's why our public health order prohibits public and private gatherings that occur outside of a single household. In conclusion, more than anything else, Inauguration Day is meant to celebrate a peaceful transition of power. So let's remember that the most patriotic thing we can do for our country is stay peaceful. Let's also remember that the most important thing we can do is keep each other safe, prevent the spread of COVID, stay at home, wear your mask, wash your hands, and abide and listen to the public health orders. Thank you all, and please be safe. And if you see something, say something. Call us. Thank you, Mayor.
Dr. Colfax?
Yes, good morning, everyone. Thank you, Mayor, for your continued leadership. And Chief Scott, thank you for everything you're doing and your team is doing to keep our city safe. You know, it's been nearly a year since we first began talking about this unfolding and unprecedented health crisis that we knew was coming our way. And let's be proud of what we've accomplished together. As one of the first cities in the nation to shelter in place due to COVID-19, we understood what we were asking of all of us: hardship and sacrifice. We asked San Franciscans to trust us and to follow the data, science, and facts. And because we all did this together, you protected our hospital system, and together we saved lives. So far, while this third surge has been the worst the Bay Area has experienced, we have avoided the worst of the pandemic. Indeed, today the numbers in the United States are hard to comprehend. And who would have thought a year ago that we would have nearly 400,000 people in this country dead of this virus. That is sad, sobering, and it is tragic. And we understand what this sacrifice has meant to the city. Be assured, every action we take is with the goal of reopening as safely and as soon as possible. And now, with the vaccine starting to arrive, it is hopeful for all of us, finally. But even as we discuss vaccine rollout, we must remain vigilant. Unfortunately, as the mayor has said, there's not enough vaccine yet that we could administer it to keep us safe from these immediate surges, including the one we've been experiencing since November. Believe me, I hope as much as each of you that more vaccine comes as quickly as possible so we can get it into arms. First, let me brief you on the numbers. As this slide shows, new COVID-19 cases remain higher than during our post-Thanksgiving surge. We are now averaging 333 cases per day. This is very high. For example, we see that our current case rate is at 38.3 per 100,000 people, down slightly from the peak of 42.5 on January 10th. This trend is promising, but it is too early to know for sure, so we can simply not let our guard down. Our current number per 100,000 is far higher than our summer surge when we peaked at just 15.4. But we are still doing better than California as a whole, where the average is 100.9 per 100,000 people infected. Now, as this slide illustrates, our data shows some relatively promising news on the hospitalization front as well. The post-holiday rise in hospitalization appears to be slowing. As of Saturday, we had 244 COVID-19 patients in San Francisco hospitals, and we currently have 24% remaining ICU capacity. In fact, our weekly change in hospitalization rate is down just barely by 1%. That rate of change is important because it reflects the demand put on our hospitals for acute care and ICU beds to care for COVID-19 and other patients. So again, this is promising and hopeful news. As I think about the work that has gotten us to this point, I think of some of the challenges that we've overcome as a city this year. And now, with the rollout of a historic vaccine program, we see challenges across the country again in everything from production to distribution. Our vaccine program, like so much else we have undertaken, will be a partnership among the city, healthcare providers, pharmacies, and the communities we serve. Let me stress, these vaccines are remarkably effective. They are our ticket out of this pandemic, and they are very safe. In partnership with our comprehensive healthcare systems, we are building a comprehensive vaccination network with a variety of options for all of those who live and work in San Francisco. This system is focused on equity, speed, and access. Vaccine will be available from whatever healthcare system you currently get services and at whatever location is comfortable and convenient. A large drive-through site, or a small community clinic with staff you know and trust, or a local pharmacy, or your doctor's office, or a vaccination site at a transit hub. We will continue to vaccinate the more than 210,000 people in San Francisco in phase 1A and those 65 years and older. San Francisco has more than 110,000 people aged 65 and over. Individuals 65 and over make up 15% of our COVID-19 infections, yet they make up 85% 85% of the people in our city who have died from COVID-19. And we will be ready when more vaccine is available. And we will be ready when we move to the next group of priority populations based on state guidance, which prioritizes people by their risk of exposure and risk of spreading the virus. Indeed, we will be ready to vaccinate 10,000 people a day. But right now, our challenge is the lack of vaccine. All the vaccines allocated to the San Francisco Department of Public Health have either been administered or are earmarked for those who have been scheduled to receive a first dose and those who need a second dose. Given the current state, the DPH vaccine supply will be exhausted by Thursday, the day after tomorrow. This week, along with healthcare providers across the city, we received a fraction of the doses we requested from the state. DPH's allocation from the state arriving this week is only 1,775 doses. Moreover, DPH paused on using 8,000 doses of Moderna vaccine out of an abundance of caution and guidance from the state due to possible increased side effects from this specific lot of Moderna vaccine. As of today, we have not received any replacement doses. This will have an impact on the city's ability to complete already scheduled vaccinations. The inconsistent and unpredictable flow of vaccine from the state and directly at the feet of the feds is not only impacting DPH, but our city healthcare providers as well. I know many of you have had frustrating experiences trying to get appointments. Unfortunately, we must continue to have patience as supply ramps up and distribution rapidly improves. There will be challenges as the nation begins the unprecedented rollout of mass vaccines. And as production ramps up by manufacturers, we anticipate large deliveries over the coming weeks and months. And we, along with our healthcare partners, will be ready to get these large deliveries out the door and into arms. With our high volume sites, our community clinics, our pharmacy partnerships, and our community and mobile pop-up sites, when supply is available, operations to administer the vaccine will be ready. With the vaccine here, we can see the light at the end of the tunnel, but it is just as important as always that we stay vigilant as a city. I cannot stress it enough. The most important thing you can do now to slow the spread of the virus is to take the precautions that have become second nature to so many of us. Please wear that mask over both your mouth and your nose whenever you go outside. Wash your hands frequently. Stay at home as much as possible. Do not gather with members outside of your household. And certainly do not go out if you are sick. We are in this together, and together we will get through this. We will bring back our communities, our economy, and our city the same way we continue to fight COVID-19, by working together. Thank you.
Thank you, Mayor Breed, Chief Scott, and Dr. Colfax for your remarks. Before we start the question and answer portion, we're going to take a moment to allow reporters to submit any final questions they may have on WebEx. We'll be right back. Thank you for your patience. When you're ready, Mayor Breed, we'll begin. Your first question comes from Joyce Cutlett, Bloomberg News. Businesses earlier in the pandemic asked the city to tap into the health security funds. How much has the city collected from employers, and how much has been spent for health reimbursements since last March?
Well, we'll get you that information, but as you know, these funds are very limited. And so what we've tried to do is get creative as to how we can spend them in a way that supports the population that it's intended to support. It's been definitely very challenging, but we've been able to issue $500 checks to individuals who qualify, who fit within these categories. And we wanted to provide an additional resource for those who would not necessarily feel comfortable getting tested or even taking time off work because they weren't able to collect unemployment or healthcare or anything else for that nature. These are the kinds of funds that should be used for this purpose. And so we've been able to do just that. But as you know, the ability to use this money in the first place is very limited, and these funds are restricted. And so we've had to get really creative to make sure they get in the hands of the people that it's intended to serve.
Thank you, Mayor Breed. Your next question comes from Lily Tan, NBC Bay Area. You mentioned SF would run out of vaccine by Thursday. How does this impact the opening of the mass vaccination site at City College? Will it still open at the end of this week?
Well, to be clear, when I say run out by Thursday, we're specifically talking about what the city has control over through the Department of Public Health. And we are definitely planning to continue to move forward to open the City College site because we are working with other healthcare providers like Dignity, like Kaiser, like CPMC, because we know that they are still administering the vaccine. So it should not have a significant impact. But we are prepared so that when we receive the doses, we don't want to wait around. We want to get them into the arms of individuals who we know need them as quickly as possible.
Thank you, Mayor Breed. We will now continue with questions for Dr. Colfax. Dr. Colfax, your first question comes from various news outlets. Are you concerned the new variant L254R found in the Bay Area or other variants from the UK, Brazil, and South Africa will reverse the progress we're seeing in fighting the pandemic? And is there a possibility that current treatments and vaccinations will be less effective against these new variants?
So I think it's important to stress that we see variants in these types of viruses. This is the natural evolution of the virus to some degree. So while some of these variants are more concerning than others, we really need to get more information with regard to their characteristics. Certainly with the UK variant, for instance, we know it is more infectious. This additional variant that was recently described in the Bay Area also appears that there's a likelihood that it is more infectious. But I think that the bottom line is we are still gathering more information. There's no reason to panic. We know that the activities that we continue to engage in, the social distancing, the masking, and avoiding gatherings outside of your own household, those are effective prevention activities. We have no information at this point about these variants that those activities would not be able to prevent transmission of the virus. And certainly scientists are looking at the characteristics of these variants with regard to the vaccines, but we don't have additional information for most of these variants with regard to that, except with the British variant, which is, I think you know, Pfizer determined would not be resistant to the vaccine. So again, this is going to be part of this pandemic. As we see variants emerge, we're just going to have to learn more about them, but also ensure that we take the prevention activities that we know slow the spread of the virus.
Thank you. And similar to the first set of questions, when will lab studies of the new coronavirus variant L452R be complete to help answer those questions about increased transmissibility and possible impact on the efficacy of currently authorized vaccines?
So viral sequencing is an ongoing process, and this is something that virologists do at laboratories across the United States, including at UCSF. So that's an ongoing process. I will say that the infrastructure for doing this across the country is small relative to many other countries. So there's a very limited ability to do the sequencing, but it will be an ongoing process. This is something that is done on a routine process, but on a routine basis. So it's never actually complete. There's a constant assessment of viral genotypes that goes on. It's that these specific genotypes are now emerging as a more frequent contributor to the viral population in the Bay Area. So why that is the case is still under investigation.
Thank you, Dr. Colfax. The next question comes from various news outlets. Has the city had to withhold any vaccine doses from the questionable Moderna vaccine lot? And if so, how many? How much has that affected the city's vaccine rollout?
So we've received from that specific lot, we received 8,000 doses, and those are now we've paused on those out of an abundance of caution per the recommendation of the state. And as of today, we have not received any replacement doses. So it will have an impact on the city's ability to complete scheduled appointments this week. Yeah.
Thank you. Your next question, again from various news outlets. Is the city receiving a lower allocation of vaccine doses than expected? The mayor mentioned the city will run out of doses this week. Can you explain?
Well, I think it's just this really unfortunate lack of reliable supply. I will give you an example. Last week, we got 12,000 vaccines. We were expecting 12,000 this week, and this week we're only getting 1,775. So that's just an example of why it's so complicated right now, and this unreliable source makes it very hard to plan, and is one of the key reasons that we're scheduled to run out of vaccine the day after tomorrow, Thursday, within DPH.
Thank you, doctor. The next question comes from Matt Green, KQED. Based on your data, fewer than 30% of doses received by the city have been administered. How do you account for this lag on the local level?
So much of the vaccine received is being delivered by other healthcare systems across the city. And those healthcare systems I know are working to get the vaccine out as quickly as possible, but we don't have any direct control in terms of their ability to do that. Here at the health department, we have either administered the vaccine or all that vaccine has been allocated. So again, we are due to run out of vaccine this Thursday.
Thank you. The next question comes from Heather Knight of the San Francisco Chronicle. When do you anticipate vaccine doses arriving in bigger numbers? When will all San Franciscans who want vaccinations be able to get them, in your estimation?
Heather, I wish I had an answer for you on that one. What we are doing, as you know, is scaling up a multi-pronged approach to ensure that when that happens, we get vaccine into arms as quickly as possible, including these mass sites, including the continued expansion of our clinical sites, the pharmacy partnerships, and the community pop-ups. So San Francisco is and will be ready when that day comes. I certainly hope with tomorrow's change in federal leadership that that day is closer than it otherwise would be, but we're ready when that happens.
Thank you, Dr. Colfax. Your final question comes from various news outlets. Do you anticipate the stay-at-home order lifting for the Bay Area in the near future? What do you think the 4-week projection for the city is?
Well, I think as I showed you, we have some hopeful signs with regard to case rates starting to drop, hospitalizations starting to level off. And we are looking at those data very, very carefully. So I'm hopeful that we will have, if that trend continues, I expect that we would potentially move out of the stay-at-home order, obviously sooner than if those cases continue to skyrocket. I don't have a specific date to share with you, but right now I would say for the trend is currently in a positive direction. But again, we will only get there if people continue to maintain the safety, the prevention precautions that we know work to slow the spread of the disease. This is no time to let down our guard. And the sooner we continue with those prevention activities, the faster those numbers will go down and the sooner the stay-at-home order will be lifted.
Thank you, Dr. Colfax.
Thank you.
There are no additional questions, and this concludes today's press conference. Thank you, Mayor Breed, Chief Scott, and Dr. Colfax for your time. For future questions, please email dempress@sfgov.org. Thank you and have a nice day.